to deal with and live with and be healthy with the smoke we experience. And I was just checking if you were following. We don't have a copy of the program actually today, but anyway, she is going to talk to us about dengue, and as Dave said, two of us in the board have had it already.
Thank you for the introduction. Well, as you know, I was introduced as a pulmonologist, so many of you may have questions as to why am I going to talk about this infection as a pulmonologist, because it's an infectious disease. Well, I am a pediatric first, a pediatrician, and for many, many years we have known dengue infection to be primarily an infection for kids, for children, and therefore I would know a little bit of it to be able to discuss with you today. So what is dengue infection? Actually, this is a virus infection that is very common in more than 100 countries around the world, primarily in the tropic and subtropical region, where there's this particular mosquito that loves rain and warm humidity during the rainy season in these countries, and therefore they breed and then they carry this virus. So dengue virus spread through bites of mosquitoes, especially the ones are of Aedes species, Aedes aegypti, and that's the most prevalent one in Thailand as well. Dengue virus has four major strains, type 1, 2, 3, and 4. And once we get an infection from one particular strain of this virus, we produce immunity to fight it off, and therefore it has a long-lasting protective immunity. But it does not cross-protect to the other strain, and therefore each human being can be infected with dengue infection up to 4 times in their lives. Yeah, once it's already miserable enough, and talking about getting it 4 times. Yeah. So how does it transmit? How can we get this infection? Dengue viruses are spread through the bites of these infections, the mosquito bites, and these mosquitoes are primarily around us, especially, it used to be in the monsoon season or rainy season in Thailand, between the month of, say, late June till early September. That's when it used to rain a lot. But as we know about climate change, it doesn't stop right there. Rain can come anytime now, and only a few months of the year we would get a very, very dry, hot condition. Other than that, it's just a rainy day and a non-rainy day. So there's lots of mosquitoes around us, especially this year. There's been reported cases of dengue infection that doubled of last year. So there's a lot of breeding of these mosquitoes going around us. And once the mosquito bites an individual with dengue virus, it carries with it. And when it bites other people, especially in the same household or in the neighborhood, it can carry and transmit that virus. These viruses don't do anything to that mosquito, so it can live with that virus for many, many days throughout its life cycle. But eventually, human beings when we get bitten by these mosquitoes, we also get the virus that it brings with us. And then there is occasionally a pregnant woman who is already infected with dengue can pass this virus to her offspring at the time of birth as well. So we've had few number of cases. This is this doesn't happen every year, but occasionally we hear about a newborn within the first month of life being infected with dengue infection. And then as a medical personnel working in the hospital, me and my staff have to always be very careful about the transmission of dengue virus through blood transfusion, through organ transplant, or through the needles that we handle people who have dengue viruses. So this is how it spreads. So there's a mosquito that bites someone who is infected already, and then it carries the virus in itself for about 8 to 10 days. That's the incubation period in that particular mosquito. And then when it bites the next person, this person starts to build up and have immune process against the virus, and then in 4 to 13 days later can have an infection, a full-blown dengue virus infection. What are the symptoms when you get infected from dengue? So basically, some people, like yesterday itself, a child, an 8-year-old boy, mom brought him in to see me because he's just had very high fever, 39.5 degrees Celsius fever at school. And mom picked him up. He had a very terrible headache. So mom was worried and brought him in right away, telling me that just a day before that, he was playing outside in the grass area in the house, in the lawn, and he got bitten and came back inside with multiple mosquito bites. And now mom is very worried about dengue infection. So first things first, I checked him out, and then I clarified to her that no, that's not what you're thinking of. But if next week your child has another high fever, maybe that's a possibility. So there's an incubation period from the time you get bitten by that mosquito up to, say, 4 to 10 days before you actually develop. So sometimes you don't even know that you've been bitten a week ago, and then you develop the symptoms of it. So what are the symptoms that you need to look out for dengue infection? So there are definitely fever, and it's usually very, very high fever. Textbook says that it causes major headache, body aches. It also has been known to, the nickname of dengue virus or dengue infection is called break bone fever. So it really, really hurts to the core, and joint pains, and basically you're miserable when you have that fever. Severe headache, and then some pain behind your eyes because of the pressure that it causes, muscle and joint pain. You may also feel nausea, and you may also throw up a couple times. But generally, you will not have any other symptoms. You're not having a cold, a cough, unlike influenza where you've been coughing a lot, you have lots of runny noses. This is particularly a full body ache and just fever with no other symptoms besides feeling nauseous and absolutely no appetite at all. So your tummy hurts, you feel bloated, you don't feel like eating anything. That actually weakens your immune system in order to fight it. And then sometimes the first few days you may, occasionally some people will come up with rashes as well. Along with fever, you may have rashes all over the body. But generally, in cases of dengue, you will not find this rash until recovery, until you are done with the virus. Yeah. So there are phases of this, and there's clinical severity. Not everyone with dengue infection will have to end up being in the hospital or being very severely ill like that. So there are various presentation of this infection. The first one is called like a viral syndrome. Sometimes the very first time you get infected with dengue virus, you may have a fever for about 3 to 4 days, and you rest it out, you drink lots of water, you are just kind of in bed and out of bed a little bit, and then you just recover on your own without even knowing that that was a dengue virus infection. So there's also a possibility of just having it as any viral infection. You may feel like, oh, maybe I had a flu and I just had to be in bed, but it could have been this particular virus. And then overall, when you have a severe, more clinical pictures of having throwing up, you go to see a doctor, and then you take blood tests and you find out that yes, this infection is a dengue infection. You get maybe or maybe not hospitalized, and you recover with any complications, no complications. And then there's other two severities that involves your platelet count in your body. So this virus, what it does is that the first few days of fever, so this is to make you understand, these are days of infection and illness that start off here. And at the beginning, you have very high fever, up and down for up to 3 to 4 days. That's when you have huge virus in your body, and it's causing this immune system that you're trying to fight it off, and therefore you have lots of fever, up and down, nearly every 4 to 6 hours. You may have a rise in your body temperature, feel the chills and body aches, and then you take some medicines, you feel better again, and then 6 hours later, again, you're back with the fever again. So this is a febrile phase. And generally, when your immune system starts to build up, this is your IgE and IgM, the blue and the gray line, that's your immune system. that's trying to fight off this virus. So as you start to fight off this virus, the viral numbers will go down. And when it goes down, your immunity is going up. This enters on the day, between day 4 to day 6, you enter what we call a critical phase, depending on your platelet count. This virus causes a major infection of the whole body, especially your blood linings, where you have lots of platelets there. And with this infection, with your immune system, sometimes your platelet count can be suppressed by the virus and your immune system trying to fight it off. So basically the interaction between the virus and your immune system causes the platelet number to go down. Now, normally, we all sitting here right now, we're all healthy. We should have a platelet count ranging from 150,000 to 400,000. That's the range of your platelet count. But when you're infected with dengue infection, it suppresses the production of your platelet, it suppresses its function, and your platelet may go down below 100,000. That's when you are at risk. Now the platelet doesn't go down right from day 1. It takes a while for your immune system and the virus to fight each other and basically see who wins the battle. If the virus wins the battle, then your platelet count will go down further, below 100,000, and that's when you are at risk of having bleeding. Bleeding as in bleeding from your nose, from the small little capillaries, bleeding from the gums, or internal bleeding. You may also have bleeding in your GI tract, gastrointestinal tract. You throw up some blood, or you pass some dark bloody stools, or even within your body, in anywhere, yeah, depending on the platelet count. Now, once the platelet goes down, if our immune system is strong enough, there's another boost of your immune system that tries to fight it off. Yeah, tries to fight it off and prevent a shock phase. So then we start to produce a lot more platelet to keep the integrity of our blood vessels so that we don't bleed, we don't have a blood pressure drop, and we are gradually going to survive this and go out of the critical phase where the platelet counts goes back up again. Then at that point also the fever subsides. So you get into the recovery phase where your immune system lasts longer. This IgE is a long-lasting immunity, and for that particular strain of dengue virus, you will continue to have this protection all your life with that one particular strain. Yeah. Now, in general, what we can do to find out earlier on. Now you're going to freak out, like how do we know whether my platelet is going to go down or not? First of all, you need to know whether that infection is dengue or not. So nowadays, back in the days, maybe say 20 years ago, we did not have the tools to find out. All we could do was wait for day 3, day 4, and repeat your blood cells to see how low your platelets are, and to think of it whether it is, just monitor the platelet count. But nowadays, right from day 1 and day 2, there is a parameter called dengue NS1, which is specifically to focus and find out from your blood whether you carry that virus or not. So we can actually find out from the time that you're starting to have fever. Again, we still have to wait it out and see, because each individual's response to the virus may be different. Someone may just recover having a fever and go into the critical phase with the platelet count of over 100,000, and therefore you recover fine. You have no complications, you have no problems during that critical phase. Whereas another human being, another person may suffer from their own immune system and have a very low platelet count at that point and need hospitalization, need care from the doctor. And that critical phase lasts only 24 hours. So as the fever is coming down, the day that the fever is coming down, generally when we recover from a virus infection, as the fever goes away, we should feel stronger and stronger. But if the day that your fever comes down, you feel actually weaker than before, you have dizzy, lightheadedness, you're throwing up even more than 3 times a day, or you start to have some bleeding, these are the signs that maybe you have a very low platelet along with this, and who may need medical attention. Otherwise, you will recover fine. Now, sometimes, like I mentioned earlier, that there could be people who actually have a dengue infection and pass through it without even knowing that that's dengue infection. That's usually the very first time you have dengue infection. It's a light infection, and it depends on the strain as well, but majority of people who have it for the first time, it tends to pass without even knowing that this could be a dengue infection. When you get the infection the second time round, so basically come another rainy season or a couple of years later, you get the second time of infection, that's when your immune system starts to work harder, combat the virus harder, and maybe that will play a role in causing a dengue hemorrhagic fever or a dengue shock syndrome where your platelet goes down very low. So that may explain some of you who have questions that I've been living in Thailand for a couple of years, why this particular year that I had a dengue infection and it was so terrible for me. It could be, and it would need an in-depth blood test to find out whether this is the second time you have it or it's just your first time. Many of you, if you have spent time in this tropical region, subtropics area, various countries around here, Indonesia, Philippines, Thailand, Sri Lanka, India, you may have had it once before without knowing it. A lot of Thai people, a lot of Thai kids also have it more than twice in their life. And it's actually the second time or the third time that is quite severe. So the question is, now we know what to do. So when we know it, how do I, as a physician, as a doctor, how would I treat you and help with the recovery? Well, first bad news is there's no antivirus. There's no way to cure it. It's just symptomatic care. So in the febrile phase, we advise you to drink plenty of water, as much as you can, to have enough fluid in your bloodstream so that when you go into the critical phase, you are not at risk of having a shock or low blood pressure. So liquid is the key. Lots and lots of fluid, bed rest, and the medicines. Now, this is very important. The platelet can be suppressed also from some anti-inflammatory, like ibuprofen, aspirin. So these are the medicines that should not be taken when you have very high fever. If you need any medicine to relieve the fever and body ache, stick to paracetamol or Tylenol. No ibuprofen, no Arcoxia or whatever you take for your joint pains and such. Those will actually cause further suppression of your platelet and make that critical phase even worse. So only paracetamol is advised. And if you feel nauseous, of course, Motilium and the things that your doctor advised you to take. Now, when you have or proven to have a dengue hemorrhagic fever, the treatment is to advise doctors to give you enough fluid through the IV just to maintain your blood pressure and get you through that critical phase. At the end of the day, it's our own body fighting this virus. Doctors is just another help that will get you through without major complications. And unfortunately, there's still no vaccine available. We had huge hope last year with the introduction of Dengue, which is a dengue virus vaccine. But within about 6 months of trial, I mean, they completed the trial already, but within the 6 months of trying to use it in human population, they started off in Philippines and then later on Thailand approved for it. So some of my patients have already got the first dose of it too. But by the time we had to give them 3 doses of this dengue vaccine. There are 3 doses. The first dose, 2 months apart, and then 6 months later to a year later, you take the third one. But within the first 2 doses in Philippines itself, they found that the data of protective immunity did not rise up to par. So basically, it wasn't still not as effective as they thought it would have been, like in the lab. So we called it back. It's still under research, so we still don't have any vaccine to protect. And therefore, what could we do to prevent ourselves from getting this infection is the most crucial thing today. So with these mosquitoes, this particular Aedes mosquitoes come with rainy season, and it breeds in stagnant water. So it lays its egg in stagnant water. And therefore, the most important thing that we can do is that make sure that there's no stagnant body of water around the house. In your potted plants, in your feeding planters, or even vase, your waste in your house, if you have flower waste and so on like that, clean the water periodically, more frequently than you usually do, so that there's no, and then, in your neighborhood, if you find, if, there are like old tires, on the sides. This is like common for a Thai family household that would have lots of small things around the house that may collect that standing water and be places where these mosquitoes would breed and lay eggs. So eliminate that, get rid of those stagnant water, and you have less mosquito around your neighborhood. Stay indoor, well-screened housing. Make sure that there's no holes or anything, especially if you have pets at home, cats and dogs that would tear apart those screen doors. Make sure that come next rainy season, it's all sealed and you have it covered. Wear protective clothing. I'm not asking you to wear jackets and thick clothing in the summers of Thailand, but wear long layers to cover your arms and your legs and such. It used to be, when my professors were teaching me, it was strictly known that these mosquitoes, they come and bite you during the day. Their life cycle seems to be an afternoon mosquitoes, and they don't bite you at night. But as seasons change, as climate change, so have these mosquitoes adapted themselves, and they no longer bite you only in the afternoons. It's all day long. So be careful with just mosquito bites. Use mosquito repellents. You have lots of spray around, especially if you can find organic ones. Lemongrass spray. Those are very good to fight off mosquitoes. And nowadays we also have those patches that you can actually apply on your clothing, and it gives out the smell of lemongrass and these mosquitoes as a repellent on your own body without causing you any irritation and any harm. And of course, once a week, go through the house, clean up all the containers that may hold standing water. That's the only way you can do to prevent yourself from getting these mosquitoes around your neighborhood and to protect yourself from catching this infection.
I was wondering if animals can be bit by a mosquito and then bacteria as well, and will they have the same effect as a person?
Very interesting. I'd have to look it up, but so far I've not heard of, and especially, I'm not sure if an animal can be infected and their immune system will carry the virus. This has always been known for human beings, and I would imagine, as a virologist, I would imagine like how certain strains of viruses, influenza viruses, only attacks or only causes infection in swine, in pigs, and certain of them only causes infection in birds, things like that, that do not cross into human beings, and we have different strains. And therefore, these 4 strains of dengue that we talk about are only found in human beings. So, and again, these animals, our pets, our domestic pets, will not be the host or the vector to bring upon infection to us. So the only way we can, so far that we know of, that we can get infected is through mosquito bites only.
Thank you, doctor, for your presentation. Just wondering about if a diet, what we are eating, can have some effect or repellent on mosquitoes.
Eat
like
more
eating
lemongrass.
a lot of garlic or something like this. Or whatever.
Yeah.
You can mention that, please.
Yes.
Thank you.
Very good question, and I think I forgot to mention in terms of prevention, because certain smell attracts mosquito. if you have a strong body odor or body smell, even some perfume can actually attract more mosquitoes to you. And sweats. So if you are sitting outdoor, sweating a lot, your sweat and your heat, your body heat, will cause those mosquitoes. I think their eyes are like radars, like infrared radar. So when you're heating up and the infrared reads red in color tone, you will be attracted, they will come to you and they will bite you more. So for sure, any food items that produces more body odor or certain gives out a certain smell from your body will attract more mosquitoes. And also darker clothing tend to find more mosquitoes towards them. So lighter clothing, though long sleeves, white or light colored clothing will keep the mosquitoes away from you. And avoid strong perfumes too.